Really small, a small community hospital, and we have about 530 volunteers on staff that give service throughout the year. Made up mainly of retirees. I have about 400 retired volunteers. Nobody in the middle years, in the working years, maybe a couple, and well over 100 students between Kent State, Hiram College, Neomed, a few from the Akron colleges, so who come and give service. And it's a great opportunity. I think that Michael and Axel, a couple of the others in the room here who do volunteer for the hospital can say that it gives you an opportunity to get in the doors of a hospital, right? To maybe experience some patient care areas, which when I believe everybody in this room is going into medicine, is that right? Or hoping to, aspiring to a medical career. So Caitlin volunteers for us. Samantha was a summer volunteer. So am I missing anybody in the room? Okay. So we appreciate service that you've given. So anyway, she wants to see the fountain, so she's excited to do that. So, but we place volunteers. When I interview you to volunteer, what I do is give preference to the fact that you are interested in medicine, and I like to place you in an area that gives you some exposure to those. So, like for example, some of the popular areas that I placed medical volunteers or pre-med volunteers in would be our emergency room. I think all of our volunteers that are here tonight actually do volunteer in the emergency room. Also our nursing units, it gets you right up in the nursing areas, bedside with patients, transporting patients. For those interested in surgery, I do have some opportunities in the surgical areas. Doing some more like staff support type things. So there definitely are some opportunities there. The commitment is usually about 4 hours once a week, and you have the same set shift every week. So that it's kind of one of those things it works nicely for students that way because it's something that you can work around your classes. I will hold those. Thank you. And that you can work around your class schedule, your work schedule. I know a lot of you are working also. So, so that works out kind of nicely. Not only do we have volunteer opportunities, but we also have service opportunities, which for a group like, it's AMSA, is that right, AMSA? You guys, one of the opportunities you can do as a group is like a service project for the hospital, which for a group like this is kind of a nice thing to be able to do, and we ripped it apart, but this was an example of a kid pack. We do use, you guys recognize these who work in the ER because we use kid packs throughout the hospital. I brought it as a sample to show you, but I kind of thought it might get used up tonight. But there are children's packs, activity packs that can be used in the children's areas, or really more in like the emergency room and the lobby areas. You know, keeping in mind that often children come into the hospital with their families in emergency situations, and the families are really not prepared to keep those children busy for any length of time, and that sometimes the wait could be hours, you know, keeping in mind they may not know even what they're coming in for. So, so these kid packs, okay, so I know it's been a long day, I know. So, but we take donations from the community and from service groups, and a lot of sororities, fraternities, church groups, Girl Scouts, Boy Scouts bring in kid packs as a service project, and they go to children in hospital waiting areas that need something to keep them busy. I don't know any children that need anything to keep them busy. I have no idea what that's all about, but so that's kind of a nice opportunity for you guys too. So I brought that. And I also brought with me some applications, although our application is online. You do need to stay here. Yeah. I brought the application. You can access our application on our hospital website. I also brought my business cards. It has the website on there as well. It's kind of easy to apply online. I also brought shadow applications, and that is another opportunity that the hospital does offer. I should clarify, we do offer shadow experiences in all areas, all healthcare careers, but I set them up except for physician shadows, and I know a lot of you would probably be interested in physicians. I also don't set up the physician assistant or nurse practitioner shadows. I do all of the other shadows. If you're interested in those, I can help you with that. If you're interested in physicians, in a physician shadow, which I'd imagine some of you want to do, I know Michael did one recently, you actually set those up independently with the physician directly. But what I can do is refer you to our online physician directory, the Find a Physician or Find a Doctor link on our website. Just a few more minutes. The Find a Physician directory online gives you the opportunity to look by specialty and to find a specialty you're interested in, and then if you want to go further in to that link, you can learn a little bit about the individual physicians as well, like where they went to school, where they did their residency and fellowships, a lot of them. And so that's kind of an interesting thing too. It's kind of nice to have a little background into those individual physicians, and more, you can kind of shop for a doctor that you'd like to shadow, and that's kind of a nice thing. And sometimes I can give you some guidance on that as well, as far as who would be good to spend some time with. So, and I know that's something you guys would be interested in. So, what else? Anything else specific, Michael, you'd like me to talk about?
Let me think.
Okay. Anything you can think of, Axel?
No, I don't think.
Okay.
Maybe about like the minimum number of hours, or
Yes, we do have a minimum number of hours, and we do have a, I'd say, a fairly rigorous onboarding process. You do a lot of hours just in the first week or two coming on board as a volunteer, because I do interview you. It's about an hour-and-a-half interview. You have to have a criminal background check, a two-step TB test. During this season, you must have a flu shot. You can't volunteer without a flu vaccine. We do offer free flu vaccines and free TB testing. And the minimum commitment to come on board as a volunteer is 50 hours, and it's 50 hours total over the course of a year. Usually you accomplish that in a semester because it's about a 4-hour once-a-week commitment. So most of my shifts are 8 a.m. to noon, noon to 4, 4 to 8 p.m., or 8 p.m. to midnight. So, usually we can find something that's a good match with your school schedule. So something to consider. Yeah.
does anybody have any questions for Stephanie? Anybody would like to ask anything?
Okay. All right, any questions for Amelia? Oh, you're not answering today? Okay. All right, well, thank you for your time, and if you have any questions, I'll leave these things here for you. Volunteer opportunities is kind of a list of 20 or 30 of our most common positions. I place in about 40 positions, actually, so there's a lot of different opportunities. The shadow and the shadow application. Okay, now you can get our stuff. Go get your backpack. Go get your backpack. Remember where it is? And our volunteer application. Okay? All right. Well, thank you for your time.
Thanks.
And thanks